Hello, this is me, Mara Carpa, and I welcome you all to your second safety adventure. Now, today, you will know in doing the primary and secondary surveys of the victim. Now, here's what you need to know. Vital signs are measures of various physiological statistics taken in order to assess the most basic body functions. The act of taking vital signs normally entails recording temperature, pulse rate or heart rate, blood pressure, and respiratory rate. Before, airway, breathing, and circulation or ABC are essential steps used by both medical professionals and laypersons such as first aiders when dealing with a patient. In 2010, the American Heart Association has rearranged the ABCs of cardiopulmonary or CPR. Now, there are two ways in conducting physical examination when giving first aid. They are primary and the secondary survey. Now, let's start first with the primary survey. It is used when the victim is unconscious and to find out immediately treat life-threatening conditions. First, check for consciousness. Ask the victim, hey, are you okay? While carefully shaking the victim's shoulder. When there is no response, not even mumbles or groans, the victim is unconscious and in need of immediate medical help. Second, open the airway. The victim's unconsciousness may be due to an obstruction in his or her airway. It may also be caused by a narrowed airway, breathing impossible. Find out if there is loss of muscular control in the throat area, which allows the tongue to slip back and block the throat. Lift the chin and tilt the head of the victim if the victim is an adult. This way you will be able to lift the tongue from the back of the throat, leaving the airway clear. Third, check for breathing. Put your face near the victim's mouth and look, listen, and feel for breathing. You should observe for chest movement, sound of breathing, or feel of breath on your cheek. Check for circulation. Locate pulse using your middle and index finger. Pulse indicates blood circulation, which is essential for the heart and brain to function. Poor blood circulation may be reflected on the pale color of the skin, and that is fatal. To revive circulation, perform cardiopulmonary resuscitation or CPR. Next is the secondary survey. Secondary survey used when the victim is unconscious or has revived. It aims to detect everything about the patient's condition. Checking for vital signs. A. Pulse rate. There are steps in checking the pulse. Use your fingertips in getting the pulse. These are the following procedure. First, place the fingertip over an artery where it either crosses a bone or lies close to the skin. Number 2. Feel the pulsations as a pressure wave of blood causes the vessel wall to expand. That is the pulse. Pulse rate may be taken in different points of the body like branchial, carotid, the wrist, temporal, and femoral. There are no's or don'ts in getting pulse rate. First, never use your thumb. It has its own pulse. Second, do not palpate both the carotid arteries at the same time. Third, do not take the pulse when the victim is in sitting position. Pulsations disappear as the victim is elevated to a sitting position. And fourth, Never put too much pressure or massage the carotid. You may disturb the heart's electrical conduction system. Normal pulse rate 60 to 70 for men, 70 to 80 for women, 80 to 90 for children over 7 years old, 80 to 120 children over 1 to 7 years old, and 110 to 130 for infants. Next, the temperature. Guidelines in checking temperature. It is being important to monitor temperature in the case of stroke and high fever. Body temperature is measured by using a thermometer within the rectum, oral, and the axillary or armpit. Next, respiration. Guidelines in checking respiration. 1. Count the number of breaths per minute. 2. A whistle sound or wheeze and difficulty in breathing may mean an asthma attack. And a gurgling or snoring nose and difficulty in breathing may mean that the tongue, mucus, or something else is stuck in the throat and does not let enough air to get through. D. Skin color. And there are guidelines in checking skin color. First, skin color reflects the circulation of blood and the saturation of oxygen in the blood. The presence of mucus around the mouth, inner eyelids, and nail beds is a sign of poor blood circulation. A healthy skin is warm and pink because blood flows normally in the blood vessels. Then we have the head to toe examination. First, head and neck. There are any lacerations or contusions in the area. You have to check the lacerations and the contusions in the area. Second, is there a presence of blood in the victim's hair? If yes, immediately find out where it's coming from. Third, is there any fluid in the victim's nose and ears? If so, the victim has a skull fracture. Second, eyes. Pay close to the attention of the pupils. Pupil appearance. If the pupil is dilated, it is in the state of shock. If very small pupils, poison or use of prohibited drugs, different size, head injury that requires immediate attention, small and bright pupils are reactive, no reaction, death. Third, chest. Check for cuts, bruises, penetrations, and other impairments. If the victim feels pain while you apply pressure onto his or her chest, there could be a rib fracture. 4. Abdomen. Does the victim's abdomen hurt? Where is the pain coming from? Is his or her abdomen tender? Do you feel any lumps? If yes, get immediate medical assistance. And the last one is the back. Is there any movement in the victim's lower extremities? Is there sensation in these parts? If the answer is yes, do not move the victim. Immobilize him or her. And that is the end of my discussion. Thank you for listening. Bye!